Welcome to Nevada Newsmakers. On the broadcast today, we're talking with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital in Las Vegas, for an update on the coronavirus for the whole show on an all-new Nevada Newsmakers.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
Pro Group Management is the place where companies can find workers' comp solutions that are designed to meet their specific business requirements. As regulations evolve, Pro Group takes a proactive approach to clear the path to make sure your business stays ahead of the curve. Knowing your workers' comp program is optimized, you can focus on other important matters related to your growing business. Pro Group Management, workers' comp that works for you.
Safety is the #1 priority for the trucking industry. Over $7 billion a year is spent on technology, like this electronic eye, that will apply the brakes automatically. But the most important factor for safety is the truck driver. These hardworking men and women who safely move over 70% of our nation's freight and 94% of Nevada's. We thank you, because trucks move America forward.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're always pleased to welcome back to the program Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital in the Las Vegas Valley. Pleasure to have you back on the program, sir. Sorry about the circumstances.
Thanks, Sam. Nice to see you today.
I wanted to bring up a headline from the Las Vegas Review-Journal that's been doing an extraordinarily good job in covering this crisis. And the editorial that came out yesterday said, "Vigilance remains vital, but signs point to progress in coronavirus battle." You agree with that statement?
I do. We're seeing that progress in kind of the slowing of the acceleration on the front lines here at UMC. And as I talk to other hospitals within the Nevada Hospital Association, they're seeing similar signs of reducing numbers across the board, whether it's bed utilization, ventilator use, COVID visits, and to include deaths.
And do you attribute this to people staying at home? Is this the main reason that you think that this is occurring?
I do, Sam. I think, our state took early actions early on, quicker than others, I believe. And it definitely has an impact, and we're seeing the benefits of that on the front lines. And I think it's helped reduce the cases overall that we're seeing, and ultimately has saved lives over these last couple of months.
When you look at, I don't know if you saw the 60 Minutes episode that aired last Sunday, but it was shocking to see the hospitals in Brooklyn that were just completely overrun. They didn't have enough masks. They didn't have enough of anything. What's the situation for UMC and the other hospitals in the Valley?
Yeah, our conditions are different than what's going on in New York. I think because of some of the heavy transit and subways and buses and just close proximity in a densely populated area, it certainly has taken its toll in that community. I think for us here in Las Vegas and throughout the state, we've learned a lot from other states that have been hit early on or been hot spots. We're holding our own. We're fortunate that we did some things early on in healthcare that I think has helped. We postponed and canceled elective surgeries. We pushed those off to a later date to do a couple of things: conserve our resources, our staffing, our PPE, but also not invite patients into a hospital that could potentially be exposed or even worse, bring the COVID-19 virus into a healthcare setting. So people are listening. They're only using the emergency rooms unless absolutely required and there's severe acute conditions. They're using forms of telemedicine and calling their physicians to be able to get diagnosed and do things over the phone. And so I think, and also I think one of the benefits too, Sam, is we're on the tail end of the flu season. So typically we're very busy between October to March, April timeframe, and we're on the tail end of the flu season, which has freed up capacity for the hospital to take care of this new type of patient coming in that we're seeing with COVID-19 symptoms and diagnosis.
So at the same time that you're seeing these positive results, there's discussion now of using the Las Vegas Convention Center, 2 floors for additional hospital beds if needed. Is the hope that this is an exercise rather than a need?
Yes, and UMC and all of our Las Vegas hospitals are built a coalition and a collaboration to utilize that facility and build that up to treat both patients that are COVID positive and non-COVID positive in a lower acuity setting, so we can preserve our ICU beds, our ventilators, and the high level of cares that you would see in a typical acute care hospital. And it's just a precautionary measure. We want to have more and then versus having too little. We hope that we don't have to use that facility, but we're running it parallel just in case. And again, I think it's wise for us to do that, and we'll look back on that, and that was a good decision. And I think our state's going to look back and all of our decisions and look and that we've done the right thing all along.
What percentage of your emergency room, your ICUs, are being used, and what percentage of your ventilators are being used at this point in time?
That's a great question, and we track that every day. Every hospital is reporting their data to the emergency operations centers, to the Nevada Hospital Association. So we get a daily report. We're going to be going to twice a day very soon, because as we continue to see cases, we want to make sure that we're utilizing all of our resources efficiently and effectively in communicating. But on our ICU beds, we're about 90, on average, about 85 to 90% occupancy in our ICU beds. And our medical floors, which is your kind of average medical surgical unit, we're around in the 60% range, but every hospital has been able to convert beds to treat patients in both COVID containment units, but also non-COVID containment areas as well. So we can segregate that population to make sure we're properly treating them based off of CDC guidelines. But we're seeing about 85 to 90% on our ICU, 65% on our medical beds, and then we're about 60% of our ventilator usage right now as we're talking today. But we're seeing, and I talked to other hospital CEOs, we've been seeing a gradual decline or peak. I don't want to say we're at the peak of the coronavirus, but we're seeing a kind of a peak as far as admissions and utilization in many categories, so which is encouraging to us as hospital operators.
What about people who are getting the coronavirus but are not needing hospitalization? Can you give us some idea of what numbers are there so that people have an understanding that, and correct me if I'm wrong, but for a lot of people, they may end up getting the coronavirus, may not even know they have it, just have certain symptoms that they don't identify, or have it and recover. Is that a correct explanation of what's going on, in addition to the people who are obviously much more ill?
Yeah, and I can tell you, I look at the hospital numbers, and in particular UMC, our statistics, and we still have, although people are listening, they're staying away from a hospital during this time unless it's absolutely severe condition and it requires an emergency services. They're seeking care in their primary care offices and telemedicine, which has been extremely helpful for us in the hospital settings. But so our overall emergency department volume's down, but about a third of those patients are COVID-related symptoms, and we're able to diagnose, screen, triage those patients and find the best setting. A lot of patients, quite honestly, Sam, are going home. They're being prescribed hydroxychloroquine here at UMC, which one of the things that we're prescribing to our patients. and they're able to go home and recover there. Those that are more acute and severe, that have those underlying conditions, whether it's hypertension, respiratory, asthma, diabetes, all those things that you've heard about, those patients we do find are being admitted and being treated up on our inpatient unit.
That medicine you referred to, that's the malaria medicine, correct?
Correct. It's been used, it's been around for many, many years. We've been able to work with the Department of Pharmacy here and the governor's office. And if a patient is hospitalized, coming into the emergency room or an inpatient setting, we are using that medication. We find that earlier on in the patient's treatment and symptoms, it's been more effective. But we're also doing some other things where we're proning patients, turning them up on their sides in a swimmer pose, and using high flow cannulas to help with their breathing. We're trying to do everything we possibly can to keep patients off of ventilators. We're finding, unfortunately, patients that go on ventilators, the success rate has been discouraging, actually, Sam. And so we're trying to keep patients off ventilators to preserve that lung tissue. And we're finding great success in some of these other treatments that we're discovering and trialing here, not only at UMC, but also all of our hospitals in the state.
What about, and this was a big feature of the 60 Minutes piece I referred to earlier, about the equipment, the masks that are needed, the gowns, etc. From the Las Vegas Review-Journal story by Michael Scott Davidson, it appeared that you're holding your own at UMC as far as being able to hold and maintain your equipment, but at great cost.
Yeah, and that was a great story. We figured let's just go ahead and invite in the RJ to see how we're doing. And we are sourcing and purchasing around the world. But I'll tell you, I'm very encouraged of our own state's entrepreneurship, their ingenuity on being able to create products for us on the front lines in our doctor's offices. I've seen some businesses convert here in Las Vegas to generate and build masks, gowns, hand sanitizer, repackage them in a way, and helped us quite greatly on the front lines. And I think that's going to be something we need to look at moving forward, is how do we create jobs here in our state to be able to produce some of these products. Will we be able to produce them as cheaply as China? Probably not, but I can tell you, going through this, we need to reduce our dependency on foreign products, and just seeing local businesses being able to create some of these products that we need to protect our patients and our healthcare workers has been a huge impact. But yeah, we're holding our own overall. The Hospital Association reports all hospitals are in the yellow as far as PPE, which means we have adequate supply, but if we do have a severe influx of patients, it brings us concern. So we appreciate the community with their donations. And the resorts have been great with cleaning products and masks and donations, and those continue to come in every single day. So I just want to say thank you to everyone who has donated to a hospital in their community, because it has made a difference.
And I want to point out that Renown Medical Center up in Northern Nevada has converted one of their parking garages into a potential hospital base to be able to move the less severe patients out, and they're also looking at the convention center to do more. Let's take a break. We'll come back with much more right after this timeout.
Because of UMC, I'm putting my free time to good use.
Because of UMC, she keeps me on my toes.
Because of UMC and this guy, I'm here.
UMC, the highest level of care in Nevada.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
This is Nevada Newsmakers.
I'm back on Nevada Newsmakers. We continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital in Las Vegas. Let's talk about, the idea of reopening the community. There was an editorial by Marilyn Kirkpatrick, the chairwoman of the Clark County Commission, and John Lee, the mayor of North Las Vegas, with a blueprint for reopening our economy. What's the medical industry's blueprint for reopening the economy in Las Vegas?
Yeah, and I think that's day by day, and I get an opportunity to sit with many of the individuals that make those decisions, and we advise them on where we're at and our status. I think certainly April is going to be a deciding month, and if I can just point out to your viewers, staying home, hospital and frontline first responders can't stay home, but our Nevadans are doing great, and we can do a lot better by staying home. So we appreciate them supporting us by staying home and allowing us to do our jobs. But I think that's going to really be the determination factor is how well do we comply and how well do we fight this virus. And I think we're seeing good signs early on here in our state.
But do you have a sense, let's push it out to May or June. And I'm not saying that those are the dates, but because we don't know. But say May or June, the governor decides that, it's time to reopen. Do you have any advice at this point in time to say, do restaurants take out half their seating? Do theaters take out half their seating? Do conventions have 6 feet or 10 feet of space between participants? Have those discussions already started, or are you too much in the middle of what's currently going on to even think about that yet?
Well, I can tell you the meetings that I sit in and the discussions that I listen to, those discussions are happening. Those teams are, how do we start our recovery and what does that look like, and from a timing standpoint, but all those specifics that you had mentioned and logistical details are happening. So it's not like we're not running this parallel to taking care of patients in the middle of this crisis. So, I think, hopefully May will be a much different story. And the early indications that I see that it's very encouraging, especially from a healthcare provider standpoint. We're getting more sophisticated on our treatments. We got better PPE. I think people are learning all the techniques to keep viruses away from you and how to protect yourself. So I think April is probably going to be one of those months where we're still hunkered down, but I see us perhaps lightening or backing off of some of the things that we've been doing in the month of May.
Okay, so at least a little optimism there. All right, let's take another break and then we'll come back. More with Mason Van Houweling after this.
Dimitri Prine here for Design Outdoor. Come visit Design Outdoor's store and backyard to see our wide selection of fire pits, barbecues, and pizza ovens, natural stone water features and fountains, and frost-proof pottery. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
One of the most psychologically damaging things parents can do to children in divorce is disparage one another, which is why I can't believe I even have to make this commercial. Half of your kids' genetics come from this person you're spewing hate about. Your children have the right to love you both, but more than that, they deserve to love themselves.
Marilyn York might be a men's rights divorce attorney, but this is for every selfish parent. Shut up!
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor full-time at RE/MAX Realty Affiliates. A lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital in Las Vegas. And in the break, you just had a quick phone call with the governor. Can you share with us something that you spoke with the governor about?
I did, yes. Thanks, Sam. And Governor Sisolak is constantly checking on us at UMC and our hospitals throughout the state. And he's been very instrumental, especially the governor's task force on COVID-19. And we've been working very directly with them on how do we bring more testing to our community with Jim Murin and his team. And they've been doing a great job. And we're looking to bring on more tests to our community. And so he's been very supportive of that. I think that's the key in all of this is testing to make sure that we're accurately diagnosing and treating patients and screening them, but also getting our death rates correct, because unfortunately, a lot of states don't have the availability of testing like Nevada does, and Governor Sisolak is very committed to making sure that we test as much as possible to make sure we get this right. So that was part of our discussion, and just been a huge advocate for not only UMC, but the entire Nevada Hospital Association.
Let me ask you this then, as regards testing, do you think that that is going to be something that once we know that the curve has been flattened and that we're on the other side of this, that testing is going to be something that is going to be an ongoing process for a number of months?
I think it will. And we already test for flu-like symptoms or the flu or other viruses, corona A viruses that are already out there that exist, that we've been testing for many, many years. This will just get rolled into the normal rapid testing. We use, in hospitals, we use a test called BioFire. It's a rapid screening test that allows practitioners to be able to quickly diagnose. So eventually COVID-19 will get rolled into that rapid BioFire testing moving forward. So as we get more and more sophisticated on testing, you'll see that more common practice for us in healthcare facilities.
Do you see that happening for conventions, for entertainment venues, perhaps even businesses, that people are going to be doing testing before they allow, just like you do at the hospital, before you allow visitors to come in who are there on official business, that they get tested for temperature? Do you think that there's going to be able to be a rapid test that people can use?
You know, I think certain things are going to get accelerated through this. You know, I've seen telemedicine come a long way over the last couple of months. Even here at UMC, we've branched out our telemedicine capabilities. Where we end up on this, Sam, it's yet to be determined. Will we fall back to some old habits? I'm sure we will. Hopefully, the silver lining in this, all of this, is people continue to be safe, do all the things that we've always talked about, get their vaccinations. You know, I think the best thing that we're going to see come out of this is that we need to expedite is a COVID-19 or coronavirus vaccination that will help with immunity moving forward. But you know, you and I have always talked about this. You know, our population just doesn't even get the flu vaccination. So hopefully this will change a lot of behaviors moving forward that will get people to get more of the flu vaccination, but also any vaccinations that come out of this crisis.
Do you think that the telemedicine part of this is now the leap into the future that the medical industry was anticipating, but especially in states like Nevada, where we don't have enough doctors, that telemedicine is now going to come to the fore because we've seen it in progress, as you say, the last couple of months?
It does. And again, I have seen a lot of things accelerate that were already being worked on, but definitely have been fast-tracked. And my compliments to Renown Health. They have always been a leader in telemedicine. We've tried to work with them collaboratively, but they really paved the way for our state a couple of years ago. And there's been parity as far as hospital copays and patient copays and driving more patients to that venue. So I think that is going to be even more pronounced in our treatments moving forward, and seeing less bricks and mortar moving as we move forward. So it's encouraging because it's the right thing to do anyways, and let's make it convenient for patients. If they're sick, stay home, which we've always encouraged, and be able to get a diagnosis over the phone and get your prescriptions delivered to your home moving forward.
I thank you so much for your time. I know how busy you are, and I really appreciate you doing this, and we'll be back to you as soon as you have some more availability to get updates. Thank you very much, Mason, and to your entire team.
Thanks, Sam. Always a pleasure to talk to you.
Thank you, and we'll be right back. A bird's eye captures its surroundings at different heights. At Brian Culpa Photography, we can make your imagination soar over buildings, parks, cityscapes, and beyond. Brian's images tell the story and get the job done. If you need a new perspective to tell your story, contact Brian today. Brian Culpa Photography. Experience the bird's eye view at brianculpaphotography.com.
Hey, Dad? What are you learning? This place is great. Huh? You gotta try this.
Wow, this stuff is great. People are gonna love it.
Yes. Yes, they will.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
Pro Group Management specializes in providing industries with the necessary components to satisfy and exceed workers' comp requirements. Every business has unique needs and specific regulations. Pro Group Management stays ahead of the curve, providing up-to-date services to keep your industry in top form. Discover how we simplify your tasks, improve efficiency, and reduce expense to keep you moving in a positive direction. Pro Group Management. Workers' comp that works for you.
You can now watch Nevada Newsmakers on YouTube. Just go to YouTube and search for Nevada Newsmakers and become a subscriber. We'll see you on the next broadcast. Thanks for watching and listening.